Hello, my name is Brittany Dennison. I'm going to be your nurse today. Can I have your full name and date of birth, please?
Israel Ramos, December 16, 2013.
All right, and I'm just going to check your wristband just to make sure everything matches up perfectly, and it does. So today we're going to be doing a general head-to-toe assessment on you. So can you tell me where you are? And can you tell me the reason for your visit?
Physical.
And do you know today's date?
September 15.
All right, good. All right, so we're gonna start off with the general survey, all right? And client is alert. Client is dressed appropriately for today's weather. No signs of illness or signs of distress. Client has good eye contact. All right, and can you do me a favor? Can you stand up for me and just take a walk to that TV and walk back? All right, slow and steady gait. Wait a minute, stand up again, and just stand up straight for me and keep your eyes shut, hands to the side. All right, keep it closed. All right, and client is able to stand still and in place with showing no signs of falling over or swaying from side to side. Go ahead and sit down. So client's motor response and verbal response is good, and as well as eye response is good. All right, so we're gonna go ahead with our general survey, and I'm gonna palpate your head, and I am just checking. I'm gonna part your hair, and I'm checking for any bumps or sores or indentations in your hair, and I don't see any. Okay, and now we're gonna go on to face. Look towards me, please. And all right, your eyes and eyebrows are symmetric. Nose and mouth are also aligned. No signs of stroke. And client doesn't have any foul odor either. All right, so now I'm gonna check your temporal pulse. All right, and that is normal and strong. And I'm gonna check your carotid as well. Okay, check the other side too. And that is also normal and strong. We're gonna go ahead and get your brachial pulse. Your uva pulse. Sorry. And your radial pulse. Those are also strong, normal and strong as well. Your dorsal. That's also strong as well. Okay, tibial. Normal and strong. Okay, so we're gonna move along. We did face. We did pulses. Now we're gonna move along to lymph nodes. But first, before lymph nodes, I'm just gonna feel around your sinus. Is there any tenderness?
No.
Okay, and now we're gonna go ahead to your lymph nodes here. And we have the pre-oral hole. That's there. Your post. Occipital. Submandibular. Your submental. And your supraficular. It's hard to pronounce and it's long. Okay, supraficular. All right, and that's also good as well. So while we're there, I'm recording. We're gonna check your eyes. Let's distract them, Mom. All right, pupils are equal and round. I can't concentrate. I'm sorry, I can't. All right, now, and that your pupils are consensual. Okay, so now we're gonna do accommodation. So you are going to look at this pen here, and then when I tell you to look up top here, the top curtain, just take a look there, and we're gonna check that for accommodation. So let's look here. All right, and then let's take a look up there. All right, your eyes did accommodate to the light and space needed. Okay. Check to make sure it's still recording. All right, did eyes. Okay, nose. Hold your, tilt your head back. All right, and there is no blood. I can see both nostrils and no nasal congestion. Now we're gonna go to mouth. And, all right, your uvula, tonsils are good. Mouth is pink and moist. All right, stick your tongue back in, and I'm just gonna check both sides. There is no abscess, no scars, bumps. All right. There is a missing tooth, but that just comes with growth. That just means that adult teeth are coming in. You have two missing, right? All right. The tooth fairy must have came, right?
Yeah.
Yeah? Okay. All right. Okay, so we got mouth. All right. Oh, can you puff your cheeks out for me? Can you frown? Smile. And stick your tongue out. Move it from side to side. All right, good. And we are going to check your ears. For any wax, we just want to make sure it's clear. There's no blockage of wax there. All right, good. And we're gonna do the whisper test. So you can just cover up one ear. All right, and just repeat back what I'm telling you.
1, 2, 3. Cheeseburgers and fries.
Okay. All right. Okay, so just making sure we got everything. The general survey, we did head, face, pulse, your lymph nodes, eyes, ears, nose, mouth. Okay, so now we're gonna move ahead to neuro. No, baby, not that. So just read this for me, if you can.
October, September, December, November.
Okay, somebody knows their months and the year. All right, good. Did the whisper test. Okay. So now we're gonna go ahead to skin and continue with neuro, and then we're gonna also do musculoskeletal. Okay. All right. So I'm just checking the temperature and the moisture of your arms. Also by checking your joints to make sure there is no swelling. All right. So can you I'm just going to place my hand against your face and you push against my hand. All right, push against. All right, also I'm going to put my hands on your shoulder, move your shoulders up. Good. Now put your, move your head up, down, side, and to the other side. Excellent. So can you put your hands up for me? And then push against, and then pull towards you. All right, and take my hands and squeeze as much as you can. All right, and that's nice and strong there. Okay, and we're gonna check your popliteal. All right. And while we're down there for the legs, just move your legs up and down one at a time. Good. Now, is there any pain in the hips when you do that?
No.
No? All right, good. Now, my hands are underneath your feet. Press down on my feet. All right. And my hands are on the top of your feet. Press up as much as you can. All right, nice and strong there. There's client does have excellent strength, musculoskeletal strength. All right. Let's see where we're going with this. Let's get musculoskeletal. We did the pulses. All right, so we're gonna go move to cardiac. Okay. And I'm just gonna take a look before I palpate and listen. No signs of COPD. Patient doesn't struggle to breathe. She's doing it effortlessly. Okay. All right, so we're gonna go ahead and I'm just feeling for thrills. That's strong. Here, take your 2 fingers and feel. Can you feel? Can you feel that? Nice and strong, right? Good. All right, so now we're gonna take a listen. Okay. This is the mitral. The pulmonic. Tricuspid. Sit up straight for me. And this is your mitral. And I'm actually going to listen to this for 1 minute. You're doing really good. All right, that 1 minute is up. So now I'm going to take my stethoscope and I'm just going to turn it around to the bell side and also listen for any abnormal sounds. Just take a deep breath. Okay. All right. So what we're gonna do is, for video purposes, can you face your back towards the camera? And we're just gonna take a listen to your lungs next, okay? First, before that, I'm just gonna make sure your spine is midline and your shoulders are aligned to each other. Just feeling around. So is there any pain or tenderness?
No.
Okay. All right. So now I'm just gonna take a listen. Now can you cross your arms like this? Yep. Give yourself a nice hug. And just take a deep breath. Very good. Again. Deep breath for me. Deep breath. One more deep breath for me. All right, everything sounds normal with your lungs. All right, so turn around, face me. Okay. All right. Okay, so now we're gonna go ahead and move to your abdominal part of the assessment. So before we go ahead, do you have to use the bathroom? No. No? All right, come on up here. And is there any pain? Do you feel any pain in your abdominal area? All right, good. Good job. All right, just move closer to me. I'm sorry. All right, that's good. All right. I'm just gonna feel. Okay. No pain, right? No tenderness? Okay. All right. This is your right upper quad. Your right lower quad. Left upper quad. And here's your left lower quad, where your sigmoid colon is. Okay. And I'm just gonna take a listen now. So each quad, you should listen for about 5 minutes each. And the normal sounds we're looking for are 5 to 35. We don't want to have hypo because that's lower than 5, and hyper is more than 35. So we want to be in the normal range. Right upper quad. This is where your appendix is. Right upper quad. All right, right lower quad. I'm sorry, that's where your appendix is, right lower quad. And right upper quad is where your liver and gallbladder is. And your left upper quad is your stomach and spleen.
No.
And your left lower quad is where your sigmoid colon is. Okay. All right. And I'm just going to feel around above your pubic area. And I'm looking for smoothness, no bumps. Make sure the color is the right color that it needs to be. Okay. No scars either. Okay. Now, do you feel any tenderness or any pain so far?
No.
No? All right. And while we are here, we're going to check for your femoral pulse. All right, and that's also strong, normal and strong as well. All right, let me turn this off. Okay, sorry about that. And I'm just checking your arms here. Checking your legs. Make sure there is no lesions or edema. Checking the temperature and the moisture. And your capillary refill. Also in your toes, 2 to 3 seconds. Just good. And I'm gonna check your capillary refill in your fingers. And that is also 2 to 3 seconds. All right, so I'm just gonna ask you a few questions. Are you able to use the restroom without any help? Can you go on your own?
Yes.
All right, good. And when you are urinating, is there any blood or pain?
No.
All right, good. Okay. And do you have any questions for me?
No.
All right, so just give me a second. I just want to make sure I have included everything that I was supposed to do in your assessment. All right, and you can actually sit up for me, baby. I'm just gonna make sure I have everything. We did general survey. We did your respiratory. I'm just checking, don't mess that up. Okay. Okay. Do you think mommy forgot anything?
No.
Are you sure?
Yeah.
All right, so wait a minute. We did general survey. We did the head, the ears, the eyes, the nose, the mouth. Did we get a pulse?
No, you didn't even close the door when you said.
I did provide privacy in the very beginning. So I did provide privacy for you.
Oh.
Wait a minute, don't turn that up. I just want to make sure I got every pulse.
You got the sanitizer part though.
Yep, I got hand hygiene. I got that. Your respiratory was normal. You didn't struggle with breathing. Check your thoracic cavity. Check your skin temperature for moisture. No, yeah, I think that's it. All right, so if you don't have any more questions for me, I am finished, and thank you for your time, and your doctor will be in with you shortly. Okay? All right, thank you.